And here we are. So this is all possible because actually Kristen, who's sitting back there, has rigged this amazing experience. She's actually blocked the sun. We've got wires taped everywhere. There's about 5 bazillion cameras around. So and she actually worked with every single 8th grade student on their own personal project and their tech support. So the hours are enormous. Thank you so much, Kristen. Definitely cannot have done it without you. So 8th grade projects. We've seen 3 already this morning. There was Connor, and then there was McKenna and Taya. Connor had musical theater. I'm like, Aya, no, not yet. McKenna had American Sign Language, and Taya had Celtic music. So these projects in 8th grade are this culminating experience of an experience with a mentor, where they've spent hours of what they wanted to learn. And somebody in the community said, yes, I will usher you through this process, and a relationship is formed. And a skill is learned. At the end of this experience, then, it's time to present, where they get a speech mentor, which has been a teacher at our school, who helps them with their speech writing and their presentation. And now here we are, the culminating experience that we have all been waiting for. So they've worked very hard, and today you're going to see, this afternoon, you're going to see Aya with anesthesia, and then you're going to have Aurelia with animation, and then Bodhi with woodworking. So without further ado, I'm going to give it over to Aya with an anesthesia.
Have you ever wondered what happens when you go to sleep before a surgery? I did too, and now I know. Hello, my name is Aya, and for my 8th grade project, I studied anesthesiology. Anesthesiology is the branch of the medical field that revolves around anesthesia and different types of anesthetic. When I first started thinking about my 8th grade project, I knew I wanted to do something medical related because I've been interested in the medical field since I was a kid. My mentor for this project was Dr. Amanda Alford, an anesthesiologist who works here in the Rogue Valley and a parent of 2 Siskiyou School alumni. When I reached out to her, she agreed to be my mentor and teach me the basics of anesthesia. We met several times starting in October, and I spent over 40 hours on my project in total. When I first met with Amanda, she gave me a book to read and a few videos to watch explaining the world of anesthesia. We then spent over an hour talking about the purposes and goals of anesthesia, the effects of it, and the history of it, all of which I'm going to explain today. After meeting and just talking about anesthesia a few times, it was finally time to get some hands-on practice. Late in December, Amanda brought a model and some supplies from a hospital she works at in Medford. She then taught me how to intubate a patient using these tools here. Intubation is when you insert a tube down a patient's airway in order for the doctor to provide oxygen. When putting a patient under anesthesia, the patient is intubated in order for their airway to be kept intact. It becomes the job of the anesthesiologist to breathe for the patient via the tube used for intubation when they cannot breathe on their own. The tube used for intubation is called an endotracheal tube, and it looks like this. I will now demonstrate how to intubate a patient on this model here. As you can see, this is a model of the mouth and throat. The first tool I'm going to use is called a laryngoscope. This is a Macintosh laryngoscope. It is made up of a handle, a light, and a dull curved blade. First, I'm going to gently maneuver this into the mouth, taking care to avoid the teeth. I slide it down the top of the tongue until I feel it reach the epiglottis. The epiglottis is a flap of flexible muscle that protects the throat. I lift up slightly with the tip of my laryngoscope, which gives me good visualization of the vocal cords. I pull up a bit more and slide my endotracheal tube along the blade of the laryngoscope. Once it is past the cords, I advance it into the trachea and it settles there. I then retract my laryngoscope and inflate the small balloon here by pushing air through this syringe. Once the balloon is inflated, it creates a vacuum seal that ensures that any oxygen I give them will not escape from the tube. You can use this established airway to oxygenate the patient. When you oxygenate a patient, you are manually pushing oxygen into their lungs. Next, I'm going to demonstrate how to start an IV. First, you need to prep your materials. The first thing you do is put on gloves like so. Next, you need to open this package here. Everything inside is completely sterilized. I take this, which is my saline lock, and open the package. My needle is removed from its package as well. Next, I move to prep my supplies. I take this syringe, which is filled with saline, and connect it to the end of my saline lock. Twist it onto the end and push on the end to fill the tubing with fluid. This is set aside and I move to prep my patient. I take this strip of rubber here, which is called a tourniquet, and stretch it. This is tied around the upper arm of my patient. This will cause the blood vessels down here to puff up and fill with blood. I pull it snug and tuck this end under like so. Next, I need to sterilize the area. I take this swab and pinch the wings to release the chlorhexidine, which is a solution a bit stronger than alcohol. I then move this out in a circular motion several inches from my designated site. Once it is sterilized, I take my needle and insert it into the vein at a 30-degree angle. Once it is through the vein, I tilt it down to a 10-degree angle and advance the catheter by pushing this part down. Another way that I can confirm I am in the vein is when I get a small flashback of blood into the catheter. My needle is retracted and I remove my tourniquet. Next, I grab this bandage here. This goes over the top like so. Once the catheter is inserted, you can hook it up to the IV tubing and run constant fluids into the body. These supplies must then be properly disposed of. An IV is used for pushing medications directly into the body. When pushing a patient under anesthesia, drugs and medications are pushed through the catheter and are very fast acting. Intravenous lines are most often used to start anesthesia. Another way that anesthesia can be administered is by breathing in a gas. This method is known as inhalatory anesthesia, and it is more commonly used for children who are afraid of having a needle inserted into their body. There are a few primary purposes of anesthesia. The first is to reduce pain. Many surgical procedures would be too physically traumatic to endure, and the anesthesiologist administers a drug such as lidocaine or bupivacaine to block the pain receptors. The pain receptors are a specialized group of sensory neurons that feel painful stimuli and transfer the signal to the central nervous system to process and recognize pain. The next goal of anesthesia is to prevent new memories from forming. It blocks the connections in our brain that would make us remember the physical trauma inflicted upon us. Waking up from a surgery and being able to remember what happened to us would be very psychologically damaging because our brains are hardwired to remember pain and trauma. The third goal of anesthesia is to relax or paralyze the muscles and suppress an autonomic response. An autonomic response is a reaction or action that happens without us consciously deciding to. An example of this is breathing, digesting, and sleeping. With smaller procedures, such as the repair of the extremities, it is not as important to have the patient be completely still. But with the surgery, such as brain or spinal surgery, it is essential that the patient does not move because it would increase the risk of damaging something important. Now you may be wondering, how does anesthesia work? Well, to explain that, I have a few slides I would like to show you. First, let's talk about the different kinds of procedures requiring anesthesia. The first is local anesthesia. This is used for dental procedures as well as skin operations and minor traumas. It is usually an injection of a pain-reducing drug on or near the site in question. Some of you may have experienced local anesthesia when you had a tooth pulled, or maybe you needed stitches after you cut your finger. Next, there is regional anesthesia, which numbs a larger part of your body. This is a common anesthesia used for spinal procedures, such as an epidural. An epidural is a steroid injection into the lower spine that numbs the patient from the stomach down. It is commonly used for laboring moms. And finally, we have general anesthesia. This is for major surgical procedures where a patient is unconscious, not feeling pain, not moving, and not forming new memories. There are cases such as neurosurgical procedures when a patient is awake, but they will not feel pain and they will not move. Next, let's address the mechanism of action. This is basically the process of how anesthesia works. When an anesthetic is administered, it enters the bloodstream and travels to the brain. Common anesthetics will bind to the GABA-A receptors in your brain. It opens it and allows only negatively charged particles to enter the cell. Once enough negative charge builds up, the connections between neurons essentially fade. Studies have shown that your brain still reacts to stimuli like light and sound, but because of the connection severance, the information does not process, therefore your brain doesn't send signals to the rest of your body. Once the connections in your brain are lost, the parts of your brain that maintain consciousness are suppressed. Many people think of this as sleeping, but it is actually a comatose state that was manually induced and is reversible. Once your brain is technically powered down, your body follows. A paralytic is injected and you will no longer move. A paralytic is a medication that causes your patient's muscles to relax and their body becomes immobile. This lack of movement includes automatic reactions that happen without us thinking about it. During this time, the anesthesiologist is constantly monitoring heart rate, blood pressure, and oxygen levels. If anything is off, they adjust the medication being injected and a state of hemostasis or balance is achieved. Once the patient is anesthetized, they are intubated and the procedure begins. The vitals are constantly monitored throughout the surgery. Now that we have a basic understanding of how anesthesia works, let's talk briefly about the history of it. Although there are records of natural anesthetics, such as opium, being used in the early civilizations, we think of anesthesia as being discovered in the mid-1800s. During the 19th century, nitrous oxide, commonly known as laughing gas, was a popular party drug until its anesthetic effects were discovered accidentally by Horace Wells. After realizing its uses, Horace Wells tested it on himself by having a fellow dentist extract his tooth while under the influence of nitrous oxide. After the procedure was successful, he began using nitrous oxide in his dental practice. He then decided to share his discovery with the medical world. To do this, he chose to demonstrate on a college student while giving a lecture at Massachusetts General Hospital. Unfortunately, he did not administer the nitrous oxide properly, and the student was in excruciating pain. Horace Wells was shunned for his failure, but his ideas were taken up by one of his students, William Morton, who is credited with the invention of anesthesia. Rather than using nitrous oxide, Morton opted for diethyl ether, another very potent party drug. He realized its uses after attending an ether frolic. At the party, a man injured his leg quite badly. However, he didn't seem to notice it or feel any pain. Morton observed this and began to experiment with its effects. October 16, 1848, on what is now known as Ether Day, a patient with a neck tumor at Massachusetts General Hospital was given ether before his tumor removal. A crowd of people gathered to watch as the first official anesthetized surgery took place. After the surgery, the patient described it as a scratch. This day marks the beginning of one of the most complicated branches of the medical field, anesthesiology. It has since grown into a methodical practice that is essential for modern-day surgery. This project was very challenging, but also very rewarding. The most difficult part was figuring out how to condense everything I had learned into a 12-minute presentation and being able to explain complicated topics in a way that people with no previous knowledge would be able to understand. One of my highlights was learning how to intubate because it was one of my first times doing a procedure on a model. The most rewarding part was finishing my speech and presentation. Something that I found pretty cool is that you can actually still visit the hall in Massachusetts where the first anesthetized surgery took place. It was interesting to me to learn how anesthesia works because my understanding of it was quite inaccurate before I worked with Amanda. Overall, I was fascinated by this topic and it was one of the best projects I could have chosen for myself. In closing, I would like to thank my parents for supporting me, Ms. Tisdale and the school for giving me this opportunity, Ms. Bauer for helping me with my speech and presentation, Kristen for all of her tech help, Tasia Hireman for teaching me how to start an IV, and last but not least, I would like to thank my mentor, Amanda. Amanda, you have done so much to help me get to this place today. You dedicated hours of your time to teaching me about anesthesia, and you were always eager to answer my questions. I truly appreciate your willingness to help me with my project, and I will always be grateful to you for donating your time and resources. Thank you so much for everything. Unfortunately, Amanda could not be with us in person today. She's here on Zoom, and I would love to give her a round of applause.
Questions? So we'll take some questions from anybody here, and then we'll move to Zoom in just a minute. So anybody in Pine Hall that has a question for Aya? Did you actually go into the hospital with Amanda and like see actual patients, or was this all just talking with her?
I wasn't able to go to the hospital because of COVID. In normal years, I probably would have been able to go in and like do a tour around there. I wasn't able to do that, but we did get a lot of hands-on time and we worked with the models a lot. So I felt like I got a valuable experience with that.
Yeah, nice. Anybody from here?
Kristen?
Have you ever been under anesthesia yourself?
I have. I've been under twice. Once when I had an eye surgery when I was 6, and once last summer when I had an endoscopy, I was under general anesthesia for both of those.
Nice. So we can move to Zoom if there's anybody on Zoom.
Awesome work. It's Amanda Alford.
Oh,
You did
thank
awesome.
you so much, Amanda.
It was really fun working with you. And it was fun to talk about anesthesia and sort of get back to the basics and figure out how to explain it to you. Help me, just rekindle my love for it. So it was great fun and you did awesome. Give me a call when you're done with your anesthesia residency and we'll give you a job.
Cool, thank you.
And we have a question from Miss Rozzy in 7th grade.
Okay, Aya, this one's actually for me. I'm curious if after doing this, you have interest in pursuing, like Amanda just said, either anesthesiology or something else in the medical field.
So the question was like, do I have an interest in pursuing something in the medical field? Yes, I do. I'm very interested in anesthesiology considering that, but mainly I'm very interested in surgery, specifically right now, like neonatal and fetal surgery, which is like operating on babies, which is really interesting to me. So that is definitely where I want my career to go.
Wow. We have one more from Evo on Zoom.
What do you think was the hardest part of this project for you?
Honestly, like I said, like memorizing my speech and then like actually writing my speech, because I learned a lot of stuff. I wasn't able to cover everything that I learned. I learned a lot of stuff, and so figuring out how to put everything I learned into the time slot, and then also anesthesia is not the easiest topic to understand. A lot of people don't have a good understanding of it. I myself don't have a very full understanding of it. Like I know more than the average person, but like figuring out how to explain everything I knew in a way that everyone else could understand. So that was probably the most difficult part.
Nice job, Aya. So those Zooming, we're going to take a quick break and change some things here, and then we'll be back in just a moment.